I think it's working. All right, so today we're going to finish up chapter 10, and then I have some in-class activities for you guys. So should be a fun day. Every day in that is a fun day. Okay, so we left off on this slide. I'm just going to review it because we do have the time to. So muscles of your shoulder and upper arm. First, you have your deltoid, which is going to be that triangular shaped muscle up here. Okay, so you're responsible for abduction, so taking the arm away from that midline. Pectoralis major, or sorry, common cipher injections. Okay, so whenever you get a needle in your upper shoulder, deltoid. Next, you have your pectoralis major. The pectoralis major is going to be responsible for flexing and adducting, so adding the arm to your body. Okay, so flexing and then adducting. That makes sense. I feel like I'm doing a chicken dance. Okay, it's going to be particularly important to monitor during post-surgery mobility assessments. So, like, it can get damaged in something like a mastectomy. So that's why we want you guys to be familiar with the pectoralis major. And lastly, we have our serratus anterior, which I showed you guys before. It's going to connect to like your ribs, and then it kind of like wraps around to that inner side of your scapula there. Okay, and then, so that's going to do that forward reaching motion. So moving on, you have muscles of the neck, shoulder, and back. Okay. Starting with your trapezius. Your trapezius is this really big, like trapezoid shaped muscle, hence why it's called trapezius, but it's going to take up this whole area on your back here. Okay. And so on the other side also. Now your trapezius is both going to be responsible for lifting as well as depressing your shoulders. And the reason that is because you have two sections of it. Well, you have three sections of it specifically, but in this case, the trapezius, this area up here is able to lift your shoulders up, while this area down here is able to depress them. Okay, so the trapezius is one of those muscles that can both be, that can be an antagonist of itself. Okay, so it's going to be responsible for both raising and lowering your shoulders. It's important in cranial nerve exams because there's a very specific cranial nerve that innervates it, which we will talk about when we get there. Don't worry about that too much yet, but that's the reason why we have you guys know cranial nerve, or sorry, not cranial nerves, trapezius. Next, we have your latissimus dorsi. Your latissimus dorsi is this ginormous muscle in the back here. Okay. Now your latissimus dorsi is going to wrap all the way around to like the front of your humerus there. And that's why it kind of does all of these weird movements that you wouldn't really think of as being in your lower back. Okay. So your latissimus dorsi is going to be responsible for adducting the humerus, as well as extending the upper arm backwards. So swinging it back. Okay. Your rotator cuff. So I know in your packets I accidentally left like the individual muscles. You do not need to do that. Okay. I just want you to know them collectively as the rotator cuff. Okay. So the rotator cuff is going to be responsible for stabilizing that shoulder. There's going to be those four muscles in it called the sits muscles. But rotator cuff, shoulder, sits muscles. Okay. So looking at these muscles in motion. You can see your trapezius muscle here. Shoulder depression. Okay, so it's going to be pulling your shoulders down. Okay. You also have this upper part here, which is going to be responsible for elevating the shoulders. So pulling those back up. Okay, so that is going to be your trapezius muscle here. Next, looking at your latissimus dorsi. Okay. Now, like I said, the latissimus dorsi, that's a good one to show you guys on. I'm going to say these aren't the right ones. This one. So your latissimus dorsi, you can see, right? It's going to wrap around your back to the inside of your humerus up here, okay? So that's going to allow you to adduct the shoulder, so bringing that arm back down and in, okay, as well as pull that arm backwards. So pulling that shoulder backwards like this. Okay. Next, looking at muscles that are going to move the forearm. All right. You guys do not need to worry about knowing the brachialis or the pronator muscle. Okay. So just know these three. So the first one is going to be your biceps muscle. These are going to be found on the upper part of your upper arm. Okay. So your biceps brachii, these are going to be responsible for flexing your forearm, meaning like, I would say like go into the gun show, but flexing your forearm, okay? In opposition to those, you have your triceps. Okay, now your biceps are going to be up here, your triceps are in the back here. So when your biceps are contracting, your triceps are the ones that are going to be relaxing here. Okay, so biceps contract, triceps are going to relax. Okay. The inverse is also going to be true. Okay. So when your triceps are contracting, you are going to be extending your forearm. Okay. So triceps extending the forearm. When your triceps are contracting, your biceps are relaxing. Right. So if you're extending your forearm, this is the muscle that's shortening, right? So triceps contract, biceps relax. When you're flexing, this is the muscle contracting. So biceps contract, triceps relax. Lastly, you have your brachioradialis. Your brachioradialis is going to help flex that forearm. Okay. So it is also going to be part of that contracting with the biceps. Now, and then you also have your deltoid. Okay. Don't worry about the pronator. Don't worry about the brachialis. The brachioradialis is important because that is the muscle that you're going to look for when you guys are taking blood pressure. The other ones I believe are important just for like mobility assessments. I could be wrong about that off the top of my head. So taking a look at the movement of your triceps here, okay? Triceps, elbow extension, okay? So they're pulling that elbow outwards. So triceps pulling down like this, okay? Biceps, on the other hand, these are going to be found on the front. Okay, so biceps are going to be responsible for flexing that elbow. So flexing your forearm up. Okay. You have your brachioradialis here. So the brachioradialis is going to assist in that. Juanita?
Yeah, so you said the biceps relax and the triceps contract.
When the triceps are relaxed, or sorry, when the triceps are contracting, the biceps are relaxing. When the biceps are contracting, the triceps are relaxing. So they're antagonists of one another.
Okay. Thank you.
Mm-hmm. Okay, now looking at your thigh. So Your iliopsoas is technically two muscles, right? So they have you labeling both. Don't worry about that, okay? I just want you guys to know it as the iliopsoas. Your iliopsoas muscle is going to be responsible for like flexing the thigh. So like think about the motion that you do when you go to sit down or like when you squat, okay? So you are decreasing that angle between your leg and your abdomen over your hip, okay? So you're flexing your thigh. It gets assessed in mobility and lower back pain. All right. The other one I want you guys to know from this, quadriceps. Okay. You do not have to worry about labeling the individual quadriceps. So rectus femoris, vastus lateralis, vastus medialis, vastus intermedialis. Don't worry about these. Okay. So just so you know, rectus femoris, rectus means straight, femoris means femur. It's just a straight muscle found on your femur. The vastus muscles are named based on their location in those quadriceps groups. So vastus lateralis is on the lateral aspect, vastus medialis, medial aspect, vastus intermedius in between the two. Okay. But really what I want you guys to know, quadriceps as a group are going to be found on the front of the thigh. Don't worry about the sartorius, gracilis, adductor longus, adductor brevis, adductor magnus. Okay. I just want you guys to know this as the quads. And know that the quads have 4 muscles. Okay. So it should be pretty straightforward because quad means 4, right? So the reason why they're clinically important, 2 reasons. When you test the patellar reflex, what the quadriceps are responsible for is going to be knee extension. So like kicking your knee out. So kicking your leg out. Okay. So the quadriceps are going to kick that knee out. When you go in and you have your patellar reflex tested, that's when the doctor is going to like bang on the underside of your knee. Okay. And it causes your leg to jerk out a little bit. It's the quadriceps that are doing that action. Okay. So that's one reason why, because of that patellar reflex. The other reason why is it's a primary injection site in infants. So my cat just knocked something over. Primary injection site in infants, specifically the vastus lateralis, basically the side of your thigh. Okay. So IM injection site in infants, vastus lateralis. It's one of the reasons why we have you guys know the quads. Don't need to know specifically it's the vastus lateralis. I'm just explaining to you why the quadriceps are clinically relevant. Okay. Looking at the back of your thigh. Now we do have you guys knowing your gluteal muscles generally. Don't worry about knowing the differences between the 3. Okay. Your gluteal muscles are going to make up your buttocks. Okay. So why are the gluteal muscles important? For 2 reasons. They're important because they're a big injection site, right? I think we asked even on your first exam, like you give an injection in the buttocks. What is the buttocks like region called? The gluteal region, right? Gluteal muscles are found in the gluteal region. The other reason they're important is because they're responsible for that backswing of your leg when you're walking. Okay. So when you're doing gait and mobility assessments, the gluteal muscles are really important for that. So you're going to have that backswing because of the gluteal muscles. Okay. Don't worry about knowing the difference between these different movements. Okay. Next, you have your hamstrings, which are going to be found on the back of your thigh. Okay. Your hamstrings consist of 3 muscles. So 3 muscles. You can just write a 3 with your hamstrings. They're listed here, your biceps femoris, your semitendinosus, and your semimembranosus. Okay. Don't worry about knowing the individual muscles. I'm more concerned with you guys knowing that hamstrings have 3 muscles and they're in the back of your thigh. They're going to be important.
I have a question, Professor.
Mhm.
So when you pull your hamstrings, are you pulling all 3 of these muscles?
Maybe, but not necessarily, because it like really depends on the movement. Because the way that the the hamstrings are formed, you have like 1, 2, and then you have a third head down here, and they all come together to like a tendon that's up in here, but they all kind of like merged in different spots at the bottom of the leg. So like it depends on the motion. Like if you pull them up here, it might be that you pulled all 3, but like if you pulled it down here, it's probably only the semimembranosus. So it really depends on like the motion, I guess, of how you pulled it.
Thank you.
Mm-hmm. Sorry, I feel like sometimes I'm like not the most helpful person because I'm like, oh, it could be like yes and no, but I'm always willing to tell you when I'm not sure about something. So you got that going for me. All right, so looking at the motions. Are guys still doing elbow flexion? So starting on the front, okay? I'm using one specific quad so I can show you guys. So quadriceps are going to be responsible for knee extension. So you can see it's contracting when you're swinging that leg back out, like when it's doing that ball kicking motion. Okay. It's also going to be responsible for helping out in hip flexion, along with your iliopsoas up here. Okay. So you can see this iliopsoas muscle group right at the top here, and that's going to be participating in that knee flexion, or sorry, that hip flexion. So you can see you're decreasing that angle. So it's like when you go to sit in a chair, basically. Okay, so you have your quads as well as this iliopsoas involved in that. So knee extension, again, is going to be like kicking the ball out. Okay. Looking at the back of your thigh here, we have our gluteal muscles. Mainly, I want you guys to know this hip extension one because I feel like this is the most important one when we talk about gait. Okay, so if you look right, he's swinging that foot back. It's like when you do those donkey kicks, when you're like working out, okay, you're swinging that leg backwards. And lastly, looking at our hamstrings group, I'm just going to pick one of them. So hamstrings are going to be involved in this knee flexion. So decreasing that angle of the knee. Okay. Again, knee extension, that kicking of the ball, that is going to be your quads. So your hamstrings, you can see all 3 of them here. 1, 2, 3. Okay. Your biceps femoris has 2 heads, but don't worry about that. So semitendinosus, semimembranosus, and then biceps femoris, I believe. It's been a while since I this is the biceps, semitendinosus, semimembranosus. Don't worry about those. Don't worry about knowing the difference. You should know that hamstrings have 3 muscles. Yeah. And then I think that's all of the muscles from the upper thigh. Oh, something I forgot to point out. With your arm, okay, if you look, right, in your arm, you see this brachii come up over and over, right? You have biceps brachii, you have triceps brachii, you have brachioradialis, right? Brachii means arm, basically, okay? So if you see brachii in some way, shape, or form, it probably has to do with the arm. So if you're sitting there on an exam, you can use that like medical terminology to guide you, okay? So brachii, brachio, you're talking about your arm. Okay, so next we're going to move down to our lower leg. So looking at the back of the lower leg, so from that posterior view, okay? you have this muscle here called your gastrocnemius. Okay. Now, your gastrocnemius, does anybody know what the prefix gastro means? Stomach. It means stomach.
Digestive system.
So it just means stomach, actually. But yeah. So like if you say like gastroenterology, you're talking about like your stomach and your intestines, specifically, as opposed to like your digestive tract, because your whole digestive tract. Anyways, gastro means stomach. The way that they named the gastrocnemius is they looked at it and they're like, oh, it's got a really big belly because it has a big like muscle belly. So they named it gastrocnemius because it has a big muscle belly. It's basically a muscle that looks like it has a beer gut. They have a sense of humor. So first you have your gastrocnemius. So when people are like working out their calves and you see that like block form at the back of their legs, that's their gastrocnemius. That's really like well developed. Okay. And just underneath that, you have your soleus muscle. Okay. So you can see down here, the soleus is tucked underneath that gastrocnemius. Now they both contribute to the same motion, but the way that they do it, basically, they both attach to this tendon called your calcaneal/Achilles tendon. Okay. And if you don't know the Greek myth, I'm going to tell you. So there was a Greek god named Achilles, or no, he wasn't a god. His mom was a god. So Achilles' mother was a god, and she wanted to make Achilles like invulnerable because he was human. So what she did is she took Achilles by the heel, pinched his heel, and dipped him in like this river that made him invulnerable or immortal, right? But when she did that, her fingers covered up his heel, so his heel was left vulnerable, but the rest of his body was fine. So that's why we call it Achilles tendon, because it's based on the Greek myth of Achilles. It's also called the calcaneal tendon. The calcaneal tendon is because it attaches to this tarsal called your calcaneus. I've just always liked the word Achilles tendon better. So what happens is the gastrocnemius and the soleus together combine to this calcaneal tendon. So this Achilles tendon, okay? And that Achilles tendon is going to insert on that calcaneus, so that heel bone, right? And it is the strongest tendon in the body. However, it is vulnerable to sudden stress, so it is a frequent site of athletic injuries. Now, what happens is the gastrocnemius and the soleus, right? They are going to attach to that back heel bone there, okay? And when they contract, right, they're going to pull up on that tendon. And that tendon is going to pull up on the back of the foot, and it's going to cause the front of the foot to go down, okay? So if I'm pulling up on this back part of the foot here, okay? I'll have like toesies. I don't know. These are my toes, okay? So if I'm pulling up on that back heel of the foot there, it's going to cause my toes to point downwards, right? So your gastrocnemius and your soleus are going to be responsible for plantar flexion. So when you're walking or standing on your tiptoes. The reason why we want you guys to be familiar with them, they're really important when we talk about venous return. So edema and DVT, deep vein thrombosis, which we'll talk about later. Now, edema and VT, ooh, what just happened? Hold on. Sorry, my computer's spazzing out because I went to go brush some fur. All right. So edema and DVT, right? They're technically like circulatory problems, but these muscles are really important in them. And if you're like, wait a minute, these are really far from the heart. Yes, but your veins don't have as much like elasticity as your arteries do. So they don't have as good of an ability to like pump that blood back towards your heart. So one of the ways that your body accommodates this is something called the skeletal muscle pump. And what it does is it pushes that blood that's in your veins back towards your heart. Okay. Gastrocnemius and soleus are two muscles that largely contribute to this. They push some of that blood back to your heart. So, not that you guys are going to need to know the pathology of this, The point is just, these are important in edema and DVT. All right. Because they help push some of that blood back towards the heart. And if they are not functioning properly, you're going to get swelling because it just starts to, that blood and that fluid starts to accumulate down in your like calves. Okay. Next, we have our tibialis anterior. Our tibialis anterior tells you where it is. So tibialis, you're talking about your tibia. Anterior, front of the foot, or front, okay? So tibialis anterior is on the front of your tibia. Now your tibialis anterior, the way that your feet and your hands work, okay? Like look at your hands, right? There's not a lot of muscle in there. There's not a lot of space, but you need to be able to do all of these fine movements, okay? So the way that your hands and your feet work are very similar. You have all of these muscles in your forearm up here. And they have these like puppet string like tendons that are going to run down and attach to the tops and like the middles of your fingers. Okay. It's very similar in your feet. Your tibialis anterior has one of those like puppet strings that runs down and attaches to the front of your foot. Okay. So your tibialis anterior is going to be located in the front of your lower leg. And it has a tendon that runs all the way down to the front of your foot here. Okay. So when you contract that tibialis anterior, you're going to pull up on that puppet string that attaches to the front of your foot. And that is going to cause you to lift your foot up. So it's going to cause dorsiflexion of the foot, meaning you're going to point your toes upwards. Okay. And that is going to keep your toes from dragging on the ground when you're walking. Now, there's this really important neurological sign called foot drop that you got to look out for that affects that tibialis anterior muscle. Okay. When the tibialis muscle is not working, it causes the feet to just droop. Okay. And it's indicative of like neurological symptoms or deficits. Okay. And it can contribute to fall risk, right? Like if you're tripping over your own feet because you literally cannot pick them up. So foot drop is usually pretty concerning when you see it. Okay, let's do like 10 more seconds. Yeah, so when extending that forearm, right? So down here you have your triceps, up here you have your biceps. When you're extending the forearm, you're extending that angle, you're making that angle bigger, right? So it's going to be your triceps that are contracting, same contractors that are contracted. Your triceps are going to be contracted, right? Biceps, brachioradialis, brachialis, which you guys didn't need to know. Those are all involved in flexing. Okay, extending. Wait, did I accidentally like leave the? Yeah. This one is wrong, but the first one is right. Okay, so extending the forearm, triceps. 10 more seconds. Yeah, so flexing the lower leg and extending the thigh, right? So when we say extending the thigh, we mean across the hip. Flexing the lower leg, we're talking about across the knee. Okay. Your hamstring muscles are going to be found at the back of your thigh, right? So they're going to contribute to extending that thigh across the whatchamacallit? Extending the thigh across the hip. Okay. Now I have 2 songs for you. I also found, but the rap wasn't like as good in my opinion. I'm not gonna play that one for y'all, but I'll still like share the thing for you. Okay. So one option.
Could you send us that video?
Yep. Okay. So, I don't know, a couple of options. Like I said, there's a wrap too. But I didn't like the wrap so much. But I'll send it to you guys in case you want it. Okay, so next we're looking at musculoskeletal injuries. Okay, you're gonna see all this stuff. It's probably gonna come up in your nursing at some point. So it's good to be familiar with these things. I don't know if these are necessarily in your textbook, but like I said, we're trying to do more funds integration, so that's where these are coming from. Okay, so starting with muscle strains and sprains. Muscle strains and sprains happen a lot of the time from overuse, improper lifting, or falls. Okay. Your role as an LPN, patient management, teaching them RICE protocol, which is rest, ice, compression, elevation. Okay. And monitoring mobility. Now looking at tendonitis. Okay. Or so muscle strains and sprains just happen from like lifting things wrong, essentially, or like, I don't know, doing repetitive things over and over. Tendonitis is going to be something like carpal tunnel sort of thing. Okay. So tendonitis can happen as an inflammation from a repetitive motion. So something like carpal tunnel, tarsal tunnel, stuff like that. Basically, the tendon becomes inflamed from doing the same thing over and over again. All right. Next, you have rotator cuff injuries. Rotator cuff injuries can cause shoulder pain and weakness. They happen a lot of the time with older adults who are workers who are doing repetitive overhead motions. Your main role, assisting with ROM exercises. So ROM, does anybody know what ROM means?
Range of motion.
Exactly. Range of motion exercises. Okay. Other important things that you're going to be responsible for, pain management. So administering like NSAIDs or icing things, stuff like that. ADL support. ADL just means activities of daily living. I don't know, honestly, if you guys use that abbreviation in funds. I apologize, came up, but ADL, activities of daily living. Next, we have chronic and inflammatory muscle conditions. So firstly, you have fibromyalgia. I do not believe fibromyalgia has a cure. I think it's really just symptom management. Like, I feel like I see a lot of medications that are like meant to treat fibromyalgia pain. But basically, fibromyalgia pain is chronic, widespread musculoskeletal pain, fatigue, and tender points. So they have these tender points in their necks, above their thighs, where if you push on them, it causes a lot of pain. Okay. Like I said, mainly with fibromyalgia, again, it's supporting symptom management, maintaining medications, helping them manage pain, and also like educating them on stress reduction, because stress can cause fibromyalgia flare-ups to happen. Okay. Next, we have myositis. You have a couple different types, for example, polymyositis and dermomyositis. You don't need to know like individual. I'd be familiar with them. We did finish that exam 2 packet. So you guys can see like the specific ones that like will come up on the exam on there, but we still have to like go through them all, you know. So myositis can be polymyositis, dermomyositis. Okay. It is an inflammatory muscle disease causing weakness. So your role's really monitoring mobility, assisting with activities of daily living, and recognizing fatigue. Okay, so especially in muscle conditions that cause fatigue, right? You want to be able to recognize when that patient is getting worn out because it is probably happening at a different rate than a patient that doesn't have these chronic diseases. For neuromuscular disorders, we have muscular dystrophy. Muscular dystrophy is going to be a genetic progressive muscle weakness. A lot of the time it gets diagnosed in childhood. There's 2 different types. So you have Duchenne's and you have Becker's. Now, like I said, they're genetic. And one is only found in, I believe it's Duchenne's is only found in men, whereas Becker's can be found in both men and women. But I could be wrong about that. So basically, one is more severe than the other because like the X chromosome plays like a protective role to a certain extent in it. But you start to see this happening in childhood where it presents with this thing called Gower's sign, okay? Which is basically like when kids are like toddlers, right? And they're learning to stand up. They do this thing where they put their hands on their thighs and then they kind of like walk themselves up. And I have a picture of what I'm talking about in a second. Eventually that should go away. Eventually, you should print it out on your own. So eventually it should decrease. Now, in muscular dystrophy, you see these kids still doing it, like 5 or 6 years old. They're still standing up like that, okay? And then from there, it gets progressively worse. So with disorders that are getting progressively worse, like Duchenne or Becker muscular dystrophy, all right, you really need to be careful with respiratory monitoring because progressively it's going to start impacting those muscles we use to breathe, like your external intercostals, internal intercostals, stuff like that. Okay. Family education, making sure they're aware of the fact that it is a genetic disorder. Okay, so that means that it's not only, it probably will happen in somebody else in the family, or that it could be transmitted to future children. Myasthenia gravis. Myasthenia gravis is an autoimmune condition, meaning it is your immune system attacking itself, okay? Myasthenia gravis can cause fluctuating weakness, especially in your face and eye muscles. So it causes this thing called eyelid drooping. It can cause your smile drooping, stuff like that. Now, especially with this, you want to watch for swallowing and breathing difficulty because you're impacting those muscles up here, right? So it makes sense that you want to monitor for these symptoms. Medication timing. So they get these specific types of medication called acetylcholinesterases. The acetylcholinesterases, anticholinesterases. You have an acetylcholinesterase, which breaks down acetylcholine. Acetylcholine causes muscular contraction. That's a really long-winded way of saying these specific medications make it so that those myasthenia gravis muscles are continuously contracting, okay? So making sure that they are taking that medication on time so that they don't experience that facial droop and whatnot, like they don't deplete that acetylcholine is important. So this is what I was talking about with Duchenne and Becker's muscular dystrophy, okay? So basically what will happen is they kind of like crawl backwards and then they put their hands on their thighs to stand up, okay? So, because they can't like raise themselves up properly. There's other signs with it, but this one is usually like pretty strongly associated with muscular dystrophy. Myasthenia gravis, like I said, it's going to happen with this acetylcholine, but it causes facial droop. Okay, don't worry about knowing acetylcholine, acetylcholinesterases, all that stuff, okay? it causes this facial droop. So you're going to see the eyelids drooping and the face drooping. Okay, so by having that medication, it's going to keep acetylcholine activating that muscle. So it's really important for them to take their medications on time. I mean, they should always take their medication on time, but. Next, looking at DVT, so deep vein thrombosis, okay? DVT can mimic muscle pain, but it is life-threatening. So when you see symptoms of DVT, go tell someone right away. All right, you're gonna see DVT. Basically, what happens is a blood clot gets into the veins in your lower thigh because you don't have proper circulation going on. So it can cause calf muscle pain and swelling. I'm sure in your fun class or some class at some point we'll go over the symptoms with you, because I am definitely not the most qualified person to do that. Okay. So they're going to recognize, so you want to recognize signs early. Do not massage the leg, because if you massage the leg, you can loosen that blood clot and it can travel right up to your lungs. Compartment syndrome. I remember, like, I feel like this comes up on Grey's Anatomy quite a bit, where they like experience compartment syndrome or whatever. So like what happens is blood starts pooling in a certain body compartment and it can cut off circulation to like other vessels, all right? Which causes something called ischemia. So ischemia is going to be like that tissue dying, all right? So as an LPN, your role is going to be neurovascular checks, so like checking to make sure that your circulation is going properly, and early recognition, pain out of proportion. So like if you have a patient coming in and saying, oh, my stomach kind of hurts a little, right? That's a little different than somebody being like, I feel like I'm getting stabbed in the gut because you just like brushed by them or something, you know? So looking for that out of proportion pain. Rhabdomyolysis. Rhabdomyolysis is due to the rapid breakdown of muscle tissue. It can happen in trauma, can happen due to statins, which is a type of blood pressure medication, and it can happen due to overexertion. So one of the reasons why you look at catheter bags is not just to see if the patient is peeing. You also want to monitor the color of the urine, the output of the urine, stuff like that. With rhabdomyolysis, what happens is as the muscle tissue breaks down, you get these not toxic, well, I don't want to say toxic waste products, but like things that your body doesn't want, okay? And they stain your color tea-colored, or stain your urine tea-colored. I've heard it called Coca-Cola urine as well, and I'm going to show you a picture of it in a second. So you want to monitor that urine color. You want to make sure the patient's staying properly hydrated, and you want to like update the doctor that's supervising as much as they tell you to, I guess. I don't want to say as much as possible, but okay. So with deep vein thrombosis, you're seeing this blood clot forming in the vein in the lower area, which is pushing down. Okay. So you're going to see warmth, redness, calf swelling, all signs of DVT. Okay. So do not massage a patient's leg if it is red and swollen and puffy like this. Okay. Go tell somebody. Rhabdomyolysis, this is what I was talking about, that tea-colored urine. I've heard it called Coca-Cola urine. You see that dark color in there, okay? So that is due to the rapid breakdown of muscle tissue. Next, looking at age-related and postural issues. So sarcopenia is age-related muscle mass. This can lead to weakness and falls, okay? So over time, it makes sense that your muscles degrade, right? You want to keep walking and maintaining that muscle mass, right? So encouraging mobility, educating them on fall prevention, nutrition, stuff like that. Really important in sarcopenia, right? This is due to age-related muscle mass. So if you're working in nursing home or something like that, you might see this come up. Can contribute to weakness and falls. So it's one of the reasons why elderly individuals have a tendency to fall. Back pain. Very common in all settings. So you can sit wrong, you can sleep wrong, you can walk wrong, whatever it might be. You lift something wrong can cause back pain. So as LPNs, you want to be educating people on how to, like, body mechanics. So like lifting something with your knees as opposed to lifting something with your lower back, right? Using heat and ice in order to calm that back down, like calm that back pain down, okay? And pain control, so administering NSAIDs and whatnot. Okay. So that's all for chapter 10, and that's the last chapter before the exam. Okay, so the exam is going to be on chapters 6 through 10. All right. So let's go ahead and go on break. Juanita.
So do we need to know all of these for the exam, or this is just for our knowledge?
So the ones that are on this specific exam are in your packet, like that review packet that just got posted. I don't remember which ones they are off the top of my head right now, honestly.
You're talking about the
The
pad
ones-
open?
No, there's an exam to like review. Here, I'll pull it up.
The one that's in the email is the exam instructions, the one that's at the bottom.
I'm not sure because I haven't looked at Dr. A's announcement, but that would make sense. Yeah. So made an announcement and put it right here. So it's posted right here for you guys. There's the docx. So if you want to type on it, there's a PDF. So if you guys want to like print it out with the pictures in the right places, stuff like that. So if you just go to that announcement on the front page of Brightspace.
Oh, I didn't even know that was there. Okay.
We just did it today. Like we just finished it up this morning, so should be good for them. All right. Let's go ahead and go on break. Where's my thing? Okay. I'll set up the timer. And I will see you guys in 10 minutes. Oh, do you still have a question, Juanita? Sorry.
Are you able, because I'm having a problem downloading stuff, are you able to send that exam sheet to the emails?
I can add it as an attachment to the email, yeah. That's
Thank
fine.
you.
Mhm. So, um, one second. So I've been grading participation, and I've noticed that a lot of people lost points. So I have an opportunity to like make points up. 7. No.
I thought
Okay.
you said, I thought you said the participation points don't count when participation comes up. Are you talking about, remember when I had,
No, participation counts, but you don't have to submit anything. Like, unless it's like an in-class activity that we do like in class, it's like you don't have to grade it. I do. It still counts. It's like 75% of your non-testing.
and what is the participation?
Like participating in class.
Oh, okay.
So like if you're late to class, you get a points deduction. If you're not clicking on MCQs, that's a points deduction. So
Okay.
that's why, yeah. Like it says in the feedback, like where you're losing points if you've lost points. But I have an opportunity to make some points up. So on the winning team for the crossword. So I'm sending the link for the crossword now. You guys can start registering while I'm talking. The winning team for the crossword, so the one that completes it first, can get back a point for a day that you lost points, not a day that you were absent. Okay? So if you have anything but a 0, basically, you can bring it up to 1 point. If you have a 0 because you were absent, you cannot bring it up. Okay? It would go to like whatever the lowest one is. Teams cannot be greater than 5. Oh, let me put you at your tables. Sorry. So teams can't be greater than 5. What happened last time? You guys put like 10 people at one table, and I like let it slide because we were just playing for candy. I'm not giving half the class points. So if you're at a table that has like 8 people and you guys win, I'm just giving it to the first 5 people. Okay? You also have to be signed into the crossword in order to win the prize. You can't just get like assigned to a table where everybody does the work for you, if that makes sense. Okay. So this is supposed to be a fun way to earn back points. So let's keep it positive. So, all right. It looks like I have a bunch of people signed up, so I'm going to go ahead and hit start playing. Again, remember to sign up at the table that you are at. Okay, so that the table that you're at in class. If you guys are signed up for table 1, there's way too many people at it. I see people still joining team 1 because they see that they're winning, I assume. But like I said, only the first 5 people are getting it, so. Oh, actually, they're not even in the lead, but still, the team shouldn't be disproportionate. All right, so winners are team 1. However, there were 7 people signed up, so only the first 5 get credit. So that wins, you guys. Okay. So next thing we're gonna do, I have to shift the tables around a little bit for the next activity. So I'm gonna put you guys back in room mode and then put you back in. Whoa, what's going on? Oh, sorry. Give me 1 second. Okay. So, what's going on? Okay. Let's. Okay. So next thing we're gonna do is the chapter 10 in-class activity. I displayed it on that like screen share gallery. So, but what you guys can do, go to evaluate. Oh, let me switch to student mode. So you'll go to evaluate assignments. I believe it's page 3 now. It's going to be at the very top here. You have in-class activity chapter 10. Okay. It's a Google Drive link because I uploaded it wrong. Bad on me, but since people already started submitting it, I can't change it. So what you need to do, make a copy in order to edit. So you're just going to go to File, make a copy here. Okay. You guys are going to work at your tables to complete it and then submit it to Brightspace. So just go to File, make a copy. So the instructions are going to be up on that PowerPoint. Make sure people are clicking on it. And the same thing as always, you only need to submit 1 per group. Just put everybody's name on it. And make sure you're working at the tables you guys are at now. Yeah. What else? Once you guys are done with that, you're welcome to start working on the exam worksheet. Hold on 1 second. I'll come join your.
Yeah, when you were giving the instructions, your voice went in and out, and I didn't get any of the information.
So let me go back to the main room. Whoa, why is there an echo? So you're just gonna go to evaluate assignments. It's on page 3 of your assignments at the very top, and then you just click on this link. It's going to take you to the Google Doc, and you just go File, make a copy. And then that'll give you a copy that you can edit, if that makes sense. And only 1 person from your group needs to do it. You just got to like collab on it, if that makes sense. So I'm going to type that in chat. It's also on the PowerPoint that's up here. But it's under Brightspace. By the way, just as a reminder, like I am here and monitoring the chat and responding to like if you have questions that apply specifically to me. So just wanted to let you guys know. I have been like typing them, so.
Oh, okay.
On your table, let's
I was just gonna ask, are you able to tell us who the fourth person was in our group? Because I'm trying to submit the document, but I can't see her name. Mm-hmm. Okay.
Also, once you guys are done, like I said, you can use this time to work on your exam worksheet. Because I can't end class like 30 minutes early. So that way you guys can work in groups if you want to. Oh, come in.
Yes, I was trying to type a message to you. I was just trying to see where can we go see our participation points at. Okay, thank you.
Okay, I'm gonna be ending class in like 5 minutes here. So if you guys are still working on your worksheet and you haven't gotten a chance to like exchange numbers or whatever, maybe start doing that.
You got to send her a message. Click on my table to where it says table and go to her name, instructor, or raise your hand. She'll see your hand. Professor, I got a question too. Okay.
Cool. All right, I'm gonna go ahead and end class. You guys do not need to turn in that exam to worksheet, but we are all set. So have a good rest of your day, guys.